Hi, welcome to Unplugged with Eraldo and Daryn. And before we get started, Daryn, you know, I was looking at the news the other day, and there was another store closing. You know, the Gap, I think it was closing.
Yeah, 60 or 90 stores or something.
What is going on? What are these stores closing? And the question is, what is that doing to us? I mean, we can't go shopping anymore. There's no more, stores to go to.
I mean, you could do online shopping like my dad loves to do.
We could.
I actually don't even online shop because I actually like going into brick and mortars.
I do.
But you're right. Like, buying something with 3 clicks is really going to change your whole perception of, like, being common courtesy and knowing to look people in the eye and shake their hand, right?
People don't get to communicate with one another anymore. That's the beauty of it, right? You go to the mall, you communicate with people.
You feels like you can spend your whole life in your apartment and never have to interact with everyone and get everything the benefit of that. So,
yeah, because I took my son the other day. He's confused. Like, I have to purchase this. I just do it online. I said, why do they have a store? Good point, but this is happening. But it's horrible.
This is how society has been built. You need to wait online. No, I agree. I mean, listen, I think that you have to do extra effort now to kind of interact with people, even if it's just on online forums and understanding taking walks every day just helps, and making sure that you say hi to people. It helps.
All right, good. All right, guys, we have a lot to cover today, so we better get started. Joining us later on the show, we have the author of The Tequila Diet. That sounds very interesting, right?
Yeah.
And we have a woman who will inspire each of us to never give up on our goals. Plus, the famous chef Cedric is here to show us how to make a delicious and decadent spring dessert.
But first, we have board-certified radiation oncologist Dr. Robert Den, who specializes in the treatment of prostate cancer at Philadelphia University and Thomas Jefferson University. Thank you so much for being here.
Thank you for being here.
So excited to talk to you.
Thank you so much. I'm really excited to be here.
Okay, so walk me through SpaceOAR, which stands for Organ at Risk, right?
That's right.
I'm learning
You're
today.
learning.
I'm basically an MD. I mean,
you got your degree. You
do,
doing
right?
So tell us about it.
Yeah.
So let me take you a step back and just talk a little bit about radiation.
Okay.
So if we look at the history of radiation, we found really early on that it was an extremely effective treatment for cancer.
Right.
But one of the problems we found is that in addition, it affected normal tissues.
Okay.
Right.
So we've had a lot of advances in the field with technology to be able to actually deliver more radiation targeting the cancer and avoiding normal tissues, like the rectum or the bladder in case of prostate cancer. So what the SpaceOAR actually does is it physically creates a space between the prostate and the rectum, essentially shielding it from some of the radiation dose.
Like a barrier, right?
Exactly. So what you're able to do is actually deliver a very high dose to kill the cancer cells in the prostate. But because all of a sudden you created a space, you have less dose now going to the rectum.
Right, because what's happening right now, people are getting treated for their prostate, right? With the radiation, but it's also affecting their rectum, which could cause other issues, correct?
Exactly. Because if you think about it, we can't control the filling or emptying of our rectum.
Right.
So this means that as a radiation oncologist, in order to make sure you're definitely treating all of the cancer, you need to put margin around your area to make sure that you're completely covering the cancer. Okay. And so what that means is that some of the rectum will naturally be in the field of radiation. So in order to reduce this risk, you can actually now insert this gel seamlessly to actually create a space between the rectum and the prostate, and really allows us to deliver an effective dose, whereas minimizing toxicities and like side effects. So Eraldo, you asked me about what some of those could be.
Right.
So loose stool, diarrhea can affect our patients while they're getting treatment.
Right.
Some patients note that they may have some more serious effects later on, like bleeding from the rectum.
Okay.
And this can be really worrisome and troubling to patients.
Of course.
Right. And so when would you start doing it? I mean, do you have to be diagnosed with prostate cancer first? It could be preventative, like how?
So that's an excellent question. So the SpaceOAR itself is not actually part of the treatment for prostate cancer, but what it really does is prevents the side effects from happening from the treatment. So you would never want to do this unless a patient has a diagnosis of prostate cancer. Okay. And we use it in conjunction with radiation therapy, which is really the treatment that we're doing to cure the patient of their disease. And so what we essentially do is we're able to take 2 liquids, and when they combine, they actually form a gel. So we can inject them simultaneously into a space between the prostate and rectum.
Right.
And it creates a physical space, a physical distancing between the prostate and the rectum.
So was it approved by the FDA?
It has been approved by the FDA, yes.
How long has it been approved?
It's been approved for about 2 years now. It actually was one of the few medical devices that actually went through a clinical trial.
Oh, wow.
So they took patients and randomized them between getting the SpaceOAR and not getting the SpaceOAR, and asked patients, what are your rectal symptoms? What are your different symptoms? And what they found is that there was a significant reduction in symptoms from patients, and it reduced the toxicity that our patients see. So a lot of us in the field are using this to help us bring our quality of care to an even higher level.
Before we go, is it covered by Medicare?
It is covered by Medicare and a lot of private insurers.
That's amazing.
How can people learn more about it?
So you can go online and look at the websites. You can ask your doctor directly about it as well.
Dr. Daryn, it's been a pleasure having you on the show.
Thank you so much. This is
really
great.
appreciate it.
Yeah, of course.
Still to come, we have naturopath Carrie Pittman. She's the author of The Tequila Diet. We will not only discuss her new book, but also what Mayan medicine can teach modern healthcare providers.
Stay with us as we'll be right back.